This one's going to be a little bit difficult, because I'm not really sure what advice I have, but I'm going to try anyway. Dr. Mike, I've had CRPS, chronic regional pain syndrome. I think you got a little dyslexic with your numbers, but that's okay. Your letters with your numbers. I got dyslexic with categories. Anyway, I've had CRPS for 14 years now. I've got a pain pump and I've had for 12 years, and I get 215 milligram Roxys. And I've been telling my pain doctor for over a year now that I'm in so much pain I'm bedridden 3 weeks out of the month. I took the lower lumbar block shot yesterday, it only helped for 4 days. Any advice to tell my doctor for some help to get some kind of life? You're in a difficult spot. And what I mean by that is, I don't know, because you can't, to be honest with you, you're in a situation like my friend Cindy. You just can't afford to piss off your medical husband here, because remember I said when you get a pain pump, you're about marrying that person. And they're not listening. You're asking me to give you some advice on how to help them listen. I would ask them to, if I were in your shoes, here's what I would do. I would ask them to lower the amount of Roxy per tablet and give you more doses, including one more. So I would ask, instead of 2 15s, I'd ask them to give you 4 10s, and that's only 10 more milligrams of oxycodone per day. And you might be able to cluster your activity a little bit better if I was in your shoes. And again, though, you have to paint the story of, here's the thing, though. I think you've done this. I think you've done your homework, and I'm frustrated for you, because what you're basically saying is you're bedridden 3 weeks out of the month. I cannot imagine you haven't told him that. I believe you have. But the other thing, here's another thing that I would ask. I would ask him to write you a prescription for a hot tub. And the reason why I would ask him to write you a prescription for a hot tub is because even though it doesn't give you a discount or anything like that, it is considered a medical bill for tax purposes. Consult your tax attorney or your tax preparer. If it is deemed a medical necessity, you can write it off as a unreimbursed medical expense. And all of a sudden, then you have heat therapy modality, okay? I might, because that's what I have to use. And I think it would be very beneficial. Now, the thing about it that you have to understand is I'm not sure what the hot tub therapy does to your pump. I think nothing, though, because your pump is internal. Okay, it's not a fentanyl patch that's going to have super absorption because you get in the hot tub. It's nothing like that. You're not going to overdose because you're in the hot tub. That's not what I'm saying. I'm just saying I don't know what the effect of hot tub therapy on pain pumps is by nature. But after you clear whether or not you can use a hot tub, I'd ask him to at least give you a letter, and I would consider adding that if you have any means whatsoever. Even if you were to do a GoFundMe page saying that I need this to be able to function, something like that. But you need to show him that you're multimodal. You need to show him that you're trying to do some things on your own to help your pain. And then I would ask him for 4 10s instead of 2 5s. And I hope that helps in some way. And I'm praying for you, because you're in a rough spot. I get that there is a chance that this would be 0 times helpful. Bless God, I'm praying for you. I love you, no buts.